jointly by four organizations. Marcus also chair, Center for Social and Ecological Studies, National Center for Orientation Research, and Philosophy Department, University of Calicut. I would actually begin with a very brief introduction about Marcus also chair, and I will hand over the mic to Father Komi, who will call Promotion Center. Marcus also chair established in 2022. This was actually initiated by government of Kerala, but later on shifted to Manganam University, established by the chair. And it has some vast areas like early Christianity, Christian philosophy, religion and visual culture, religion and philosophy, and contributions of modern social to the culture and intellectual traditions in Kerala. So these are some of the thrust areas of Marcus Social Chair. We have a mandate of audience contest, which we every year we have to initiate a sort of annual lecture in the wake of Marcus also. He was a great human being. He was actually the Metropolitan of Manganam Church. He was apart from all this, he was a great humanist. He was very well known for his humorous laws and a great philosopher as well. So we, all seminars, conferences, workshops. This is actually the first one in a series of workshops which we organize. Next one is being organized towards the end of October, and there is another one towards the beginning of next year, most likely by the first week of Jan. Currently we have two scholars associated with this chair. The chair professor is the one person who is renowned scholar of early Christianity and of Syriac and tertiary language.
Already two candidates completed their PhD through this institution from Mahatma Gandhi University. So this is at the same time a theological institute and at the same time a secular research institute also. Our major focus is on the periodical training of the clergy, priests of the church. We have around 1,500 priests. We continuously organize the training programs, in-service courses, or clergy continuing education program for the clergy of the Madhoma Church. That is the main program of this institute. Another program is to encourage research and academic engagements of the lay community by organizing many lay training institute program on various subjects, theology, about other religions, secular studies, contemporary issues like that. So almost all our programs are related to academic engagements and also for doing research like that. We have a very good library in our campus. I hope you should definitely find some time to visit our library, especially for sociology, gender studies, culture, philosophy. We have very good collection of books in our library. And I take this opportunity to once again welcome all the resource persons and all the delegates of this program to our institute. Let our study and our stay in this campus be a fruitful and meaningful one. Thank you.
So I am Sanil and I teach at the Department of Humanities and Social Sciences in Delhi IIT. And for me, the starting point was that in engineering institutions, we have humanities and social science education. We'll talk about its details later. But we find in medical institutions, we don't have. But on the other hand, many of us are part of our research when we get to meet doctors. They express the need that we need to do reflect something about it, right? So then before that, couple of years ago with, Brahmautran, we had a conversation about how do we think about an academic program to bring these concerns as part of our medical education. Now, we need to address it without any models. We don't know. We hear people from humanities, cultural studies, social sciences, philosophy, doctors, uh, people from literature background. We are all from various backgrounds, but some concern that we think that all our thinking has some relevance to the practice of medicine. I think if we can bring, so that's what brings me to this, because I start with the idea that there is no immediate conversation starting point, right? We don't be, if you think that we can immediately start with conversation, it is not. So we need to think and deliberate and think about, develop a vocabulary to talk about this interaction, right? And thank you to this center. In fact, I remember when those of us in Delhi, like when we go to hospitals, we go to a good doctor, but we wait for a Malayali nurse. So that's very strange, because we feel very confident if we are handled by a Malayali nurse. And part of it is because of the traditions in Kerala, which actually nurtured, I think. Maybe you can give us more input about a certain caring traditions. And I think there is religious traditions have played a major role, perhaps, in doing this. So I'm happy that's happening in this center and this chair, which is in many religious connotations. We are going to engage with something which is totally a modern science, right? So that's also set the context for this uh, debate. So I think if we can sort of start.
I'm Dr. Sridevi. I'm working as Associate Professor in Department of Community Medicine, Government Medical College, Palakkad. Actually, Brahmaputran sir told me about the program few months back that sir is coming, and so we can arrange such a program. So I'm personally interested in humanities and also in philosophy. That is why I came here to attend the program.
My name is Dr. Sanita. I'm an ophthalmologist by profession and I run a eye hospital at Mulanduruthi. So I came to know about this program through my friend Sri Devi, and then I got connected. And the moment I got the program lead, I decided that I'm going to come here because one of the things which we all miss as students of medicine is something related to something outside medicine. After going into the medical colleges, we have a kind of tunnel vision about most of the things because that is how the system is and how we have to toil for our degrees and post graduations. But as sir told, we are not given language studies in when we go to medical colleges, whereas all other degree courses do have, they have to learn language. So, but that is one of the things which, as physicians or as surgeons, we are the people who are encountering with patients, and that kind of humane touch is missing from our academics. And then I was always interested in the philosophy, if you could call, of medicine as such. And in the train also, we were talking about, see, the different narratives. I have a very limited perspective as a ophthalmic surgeon of the patient who I'm treating. I know that I can do a good cataract surgery and the patient will get good vision. Or my thing ends there. But what about the patient's narrative? What about the relative's narrative? How do they see that? How does the economic things? All these have been in our mind for so long, but we have not attended to it because of maybe limit of time, or maybe I would say that the possibilities were less. We could do our own informal reading, we could interact, but there was no organized way of addressing or trying to address this problem. So I am very excited to be here, and the faculty, I think I have high expectations actually. So thank you so much.
I am Ravi. I have an MBBS and an MD in community medicine, but I am a very complex human being. So I've not done any doctoring for the past 2 decades at least. I teach epidemiology and healthcare systems at the Achyuta Menon Center for Health Science Studies, which is one of the divisions under the Sri Chitra Tirunal Institute for Medical Sciences and Technology, Thiruvananthapuram. SCTIMST is known as a hospital, but it's also an institution under the Department of Science and Technology, Government of India. So I am a professor there, so that's another cap that I could claim. But I am not your conventional professor either. So why am I here? It's like I am trying to find out whether I need to maintain status quo or what to do with the rest of my life. And I am taking a break from my routines and thinking, finding space and time to think about where I go from here. And that's when Brahmavutran sir shared this program, and I thought, and I want to take a break from work. And my parents are based at Punya in Kottayam district. So I was anyway planning on a break, and then I find that this workshop coincided with the date. So it just came together for me wonderfully. So that's how I'm here. What I'm looking forward to in this workshop, I guide a handful of doctoral students, and at that level, they challenge me to think beyond the routine way. Some of them at least are not there just to do a study. Somebody is exploring caregiving role, and they are trying to describe a caring individual as having an identity, a caring identity and a caring role, and trying to see how a diminishing of the identity leads to burden, diminishing of the role leads to burnout. And someone else is working on trying to develop a person-centric stroke rehabilitation. They are trying to make it gender sensitive and ergonomically informed, and they are trying to include, explore concepts of humanism, existentialism, and phenomenology so that the program they implement becomes person centric to some extent. Somebody else who's working with rehabilitation of children with developmental disabilities, and where rehabilitation has to be driven by the family and the community. So, and that study is a bit early. So the thinking is just started. So we have a doctoral program where the initial 18 months is just sitting down and thinking and conceptualizing. And I felt attending this workshop would help me do some justice to these thinkers so that their studies can be, improved. Yeah, that's about me. Thank you.
I'm Dr. Manoj. I'm from Government Medical College, Palakkad. I'm working in Department of Medicine as an associate professor. I never wanted to become a doctor, but I wanted to become study literature. So, but I am now in the Department of Medicine. When I saw this, I rekindled the old passions, so I can learn something from you. Thank you.
Hello, all of you. I'm not sure whether I should use Dr. Jomi Abraham. Okay, I'm Dr. Jomi Abraham. I finished my. Currently, I'm working as a assistant professor at Geetam, that is Gandhi Institute of Technology in Hyderabad. I finished my PhD from Center for English Studies, JNU. So I came to know about this program from my sister. She has just submitted her PhD in public health. So they are in contact, Brahmaputran sir and her. So they share a very beautiful bond. So she told me about this. So my interest in this was kindled because I did my PhD on farmer suicides. Primarily what I did was like to collect farmer suicide notes, and I was trying to look at it from a literature person and literary studies, where I was bringing in the concern of writing while dying and that space in between writing and death. So while doing my field, I did an extensive field work for that. And while doing my field work, I realized that there was this consistent effort from the ruling, whoever it was, all the governments, there was this consistent effort from their side to always portray farmers as having mental health issues. Instead of addressing the real concerns, they always tried to portray farmers as having addiction, love failure, they couldn't cope up with love failure, infertility and mental health issues, depression and all. So what they did was, like, if you go to Vidarbha, throughout Vidarbha, you'll see all counseling centers started by government as well as Disha and all this, and also Vipassana centers. So then I started thinking more, and in my thesis, obviously we have this limitation because we are doing in a certain discipline. I tried to address this I took a anti-psychiatry position in my thesis. I just wanted to further it more and read more and understand more. That's why I'm here. So I hope I'll succeed in doing that.
I'm Julie Abraham. I'm a research scholar from Central University of Kerala. I submitted my thesis already. I'm from Public Health Department. I came to know about this program from Pramod sir, and I'm working. My thesis is on about older person, aging, older person, and their quality of life and mental health. So while doing my thesis on the time, I understood that we can't see health in a like with biomedical concept or something like that. We have to think about it much more open, like in planet health way. And even determinants of health also, we can't say like only one physical determinant is there. That social determinants and all things are like intermingled. Everything is intermingled. So it's like when you think about aging also, it's like you can't say like you aging person having sleeping disorder, you can't say that go and have tablets or sleeping pills. There are so many problems behind it, social problem, their insecurities, their problems are there. So by understanding all the stuff, I understand that my knowledge about humanities and all social determinants was very limited because I came from a medical background. By attending this type of conferences, I think that I can broaden my horizon. Thank you.
I'm from the University of Delhi. So, and I teach political science at the university. um, I should begin by saying I'm really, really pleased to be here. Thank you very much, Professor Sanil, for inviting me here. Naveen telling me about this workshop. I have been an outlier in my own discipline in as much that I was interested in knowledge systems that were not mainstream. And I got interested in them to be counters or to be the basis of alternatives to the development paradigm that we were all critiquing. Of course, I feel a bit like a dinosaur here. I mean, I was studying in the 80s and doing my PhD at that time. So, but that was the time of critiques to development. And for me, the one point that really hit us as students was the Bhopal gas tragedy of 84. So for me, the interest in knowledge systems came from there. And so it led me to think about Ayurveda. And so for the last, since 87 or so, I've been interested in studying Ayurveda and understanding the social dimensions of this amazing knowledge system. And for me, with my background and interest in political economy as well, for me, the point of entry was the study of Ayurveda as it is practiced and produced now. So I spent some time studying the market of Ayurveda, trying to understand how it embodies all kinds of epistemological conflicts and what happens to what are these new products that are coming and so on. So, but for me, the interest in Ayurveda was very much as a contemporary knowledge system, which is different from seeing something which comes from a grand old tradition and has to be venerated as such. I don't think that Ayurveda is something that needs to be venerated, especially because it is a part and parcel of the everyday life of so many people in this country. So there's a difference in the way we understand any knowledge system like that. So I've been engaged with issues of evidence, of course, which is one of the most contested issues. That's something I would like to talk about here. And uh, but what excited me about this workshop, and I've come in the middle of my own semester, somehow found 2 days to come. I'm so sorry I can't stay for all 5 days. I have teaching to do as well. But what excited me was precisely the foundation that uh, there is no real study of the humanities and social sciences as part of the medical curriculum, given that doctors are the ones who meet people every day, and doctors know and are deeply sensitive to the patients that come to them. I've also always been surrounded by doctors in the family, amongst friends. So I know that these issues really bother them. And they always rue the fact that they were not trained in some way or the other, at least, when they were receiving their MBBS degrees or or even of any of the subsequent degrees. But they are expected, especially in the public hospitals and so on, they are expected to be deeply humane. They are expected to be deeply responsive to the concerns of not only the patients. I love the fact that you talk about the narrative of the patient. And what you just said about understanding the narrative of the patient you're doing surgery on. They're expected all this, and nobody trains them. And I think that that's a deeply unfair kind of structuring of the curriculum. And I feel that these knowledges, which are knowledges which never separate research and practice, theory and practice are never separated in these disciplines. Why we continue to teach them as if they are, something that baffles me. So I've come here with I look forward to conversations with doctors. And I think that the more conversations we have, the more engagement we have, the better we are going to be at it. It's not going to happen overnight, but at least the process should begin. So, which is why I'm very happy to be here.
My name is Priya Chandran. I teach at Kannur University. I teach at the Department of Studies in English in Kannur University. Yeah, so I have several reasons for coming here. One of which is professional, where I teach. Nowadays, I get research scholars who work on medical humanities. So I also need to update on my knowledge about medical humanities and all. That is one primary reason. And personally, I also have discussions with my sister who is a doctor. She's here. So when I have this discussion about the experiences we have, I as a cultural studies teacher and she as a doctor, we have there are like there are several things that we can kind of contribute to each other in terms of kind of understanding the world better, especially medical field.
How I became interested in this, but I've always been a very self-reflective person. And during my MBBS time, I think, as you mentioned earlier, during MBBS, we are taught to, I wouldn't say think, because there is no thinking involved in MBBS. You're just mugging up many things and just writing it on a piece of paper and passing. Often that happens. I don't know if everyone is like that, but that's what I felt. And there are often times when I feel like while I was doing MBBS, I didn't really understand it, because you come to contact with patient only in your third year and fourth year. And but even at that time, especially when I was doing my internship, I felt I was always in conflict with myself as how I should behave with my patient. Because you always have a tendency to behave in the way the group behaves, not just how you feel you should behave. So that was always there. And I came to learn about all those different theories and philosophies from my sister when she was doing her PhD. And it was at that time that I got exposed to, I will say, other modes of thinking or other perspectives. And with those perspectives, when I look back at myself as a student or myself as an intern and how I behaved, uh, I felt like I should have gone with my intuition rather than what everyone was doing. And I feel there is sort of an aloofness or sort of distancing that we do with the patient, maybe because we want to maintain our mental health because it is always crowded. And you are also very stressed during your MBBS time and your PG time when you are in the casualty. Those things are there, but at the same time I think we are never taught to look it from the patient's perspective, because they are coming to you at a time when they are most vulnerable, and they expect some sort of care. And what degree of care we provide, I'm not thinking about the curative part, but what degree of care or kind of I don't know, in Malayalam we can say ashwasam that you give to the patient is something that has often baffled me. And then I did my MD in community medicine. And even there, what I felt is I did it in Trivandrum. I mean, it's not something that is specific to one particular institution. But still, what I felt there is our research is often oriented towards infectious diseases and quantitative researches mostly. And very less engagement that I saw in the departments that in the colleges that I work, there is very few engagements in the qualitative or patient perspective way. And that I felt like from a public health perspective, I think it is more important to engage with the patients. I really do not know about the clinicians because they have their own things and need to worry about cure rates and all those things. But from public health perspective, as a public health, someone practicing public health, I think it was important to understand this patient perspective. And another thing is that I'm teaching now, so I wanted when I am teaching, I want my students to see that perspective also. So I try to engage them that way. But then my knowledge in that is also very limited because I was never taught that. And I do try to read myself. I try to read about power and all those things, or maybe Foucault, because my sister introduced me to Foucault, or maybe anthropology and all those things. And slowly, I kind of started liking it more than what I studied, basically, because this is more like thought provoking and engaging, and it feels like sometimes you feel like you're seeing yourself in what is written there. And that was quite interesting to me, and I really like the field. So that's why. And also, I was introduced to this by Dr. Brahmaputra, and I knew him, and he sends me very some articles and all, because I even within public health, what I was interested in was equity in healthcare and social determinants of health. And then afterwards, my sister introduced me to positionality and intersectionality. So, as she said, we found some common grounds in the discussions. But it was a very slow transition because it took my sister so many fights to make me understand or see from another perspective. But thanks to her. Okay, that's all.
I'm broadly interested in questions of epistemic democracy. So I'm trained originally as a lawyer, legal theorist, and then I think my entry into humanities is through, I think my student days, in the 90s, I used to be involved in the ecological movement, Narmada Bachao Andolan. So slowly I started thinking about questions about development, then knowledge claims about development. Then you end up about environment. Then from environment, you slowly move into technology because the environmental question is really geared through questions about technology, technoscience, science, knowledge. So that's my trajectory into what I do now in the last 10 years or so. I teach on various aspects of what we in the last 40, 50 years call as science and technology studies, which is an interdomain of bringing together questions about knowledge and power at one level, techniques of knowledge making, techniques of technology, medical technology. Sometimes we call it medical sciences. So yeah, so broadly, that's my areas around how knowledge and democracies work together. How do you unpack knowledges? That sort of thing. I'm interested in modernity in a particular way. I want to understand that. And a lot of times I end up trying to do that by looking at the boundaries, the borders, the margins, and but rather than staying at the description level at the margins, I want to enter into the belly of the beast. So I end up trying to understand. Typically, I do work around biology and biotechnology, and also increasingly algorithms and AI. That's the two sort of main domains around which I've done most of my work in the last 10, 12 years. But increasingly through PhD students and also some other kinds of personal interests, I've started looking at health systems, ideas of health, something like Tibetan medicine. So that's where, and through some of my PhD students and personal interests, in the last 4, 5 years, I've also started looking at health. I'm very excited to be here. I don't usually come to Kerala for academic events. I just come to spend time with my family. This is probably the second event in the last ever. I mean, but I came for something in Palakkad in 2019 or so. So I'm very excited. It's a different sort of way in which conversations happen, and I'm very excited to be part of it. Thank you.
Hi, I am Robin. Philosophically, we are not supposed to say that I teach philosophy because philosophy is not a discipline where we could teach. So, but technically, that's what I do. So, I teach philosophy in the department, Calicut University, and I do phenomenology. I read and research in the area of phenomenology. For the last 3, 4 years, I was totally concentrating on teaching, zero research work. Now I thought maybe it's time for to start something. I can set back to research. Who am I in the sense in the research field? I read very closely the developments in psychiatry, also something called phenomenological psychopathology. And unfortunately, I am critical to both. So that's where I stand now. So I hope we could get more opportunity while in my talk and also in the coming days to discuss further and get some more critical grip on things and to develop further. Thank you.
I'm basically a media person, now director of Kerala Media Academy. My name is Rajagopal.
I am Dr. Santosh. I have completed my PhD in sociology from Kerala University. Science sir already said that humanities is there in engineering background. I am a medical sociology assistant professor in Department of Community Medicine, Government Medical College, Kottayam. So sociology or social science sir is also a part of medical science. But there is some problem now. Even though there are 8 vacancies, only 3 of them are filled and 5 are vacant, because according to the present national curriculum, national medical curriculum, there is no importance to social science and there is no requirement of sociology faculties. They need only medical social worker. So I am here to understand your perspectives about the relation between social science and medicine, and if there is any relation, I can also apply it to develop social science as part of medicine. Okay, thank you very much.
I'm Dr. Sunita Muralidharan. I have been practicing for the last 30 years. I've done my MBBS, DGO, and MRCOG. When I did my MBBS from the Madras Medical College, for us, the SPM posting is the one where we can relax. Okay, we just go to some PHC, do some little work, and then we are free. But our medicine, gynec or labor posting, surgery, everything is so hectic. And this is the posting where we can take 2 days leave, go home, or do something like that. And that much was the importance given to this knowledge. Then we became a CRRI. That is, we are interacting with the patients. At that time, again, we are under the postgraduates and the assistant professors. We do a lot of work like taking blood, there's that, so many things. And many of the things we learn, in fact, from the sisters, the staff nurses. And slowly we develop a method of interacting with the patient. and each will vary according to that the personality of that particular person. Some might be empathetic, some may be more domineering. It depends. Then I did my gynecology. At the time, I understood more of the subject, and my field is where we are not only interacting with disease, we are interacting with the whole family, delivery and its own concerns, the family politics and whatever it is. It's at that time I realized that people are starting to look at us as not only advisor. Some ladies will want, after telling all their difficulties, they will say, next time when my husband come, madam, you please tell him this is means not to drink or something like that. Only then I realized the role is bigger than what I have been taught to do. And maybe we are trying to cope up with it, studying for the net and all those things came now only. I'm telling about maybe 20 years ago. So we were trying to read some magazines or see some other people who are doing certain things. And then whatever we are advising, we have to say in an authoritative way. Only then those people will listen. If I say, oh, I don't know, but maybe this will work, they will not listen to you. They will think this doctor doesn't know anything, that kind of thing. So, but there was a deep question. What I'm advising, whether it is right for them in the long run, or am I trying to cover my face? That kind of issues started coming. Then, when we are reading many books, maybe we get some things from here and there. That is how I started doing things. And then I did my MRCOG from UK. It's at that time I realized we Indian doctors are very good at theory and practicing or treating the patient, but we don't know how to count the patient. That is there when we went, we used to have that oxy section. Two questions are like how to counsel a grieving patient and how to face an angry husband. Okay, that they are teaching us that, because we know we do it on our means in our own style, but they are having a pattern how to face them, how to listen to them, how to advise, what else to do. Only then I realized we are lacking in those forum. Then I practiced in Dubai, and that is a different crowd. And when I came to India temporarily for my son's study, I went to this pain and palliative center at Thrissur. Only at that time, I really saw what it is for the patients, and also though it was comparatively the work-wise, it is beneath what I was doing. It was more fulfilling, and I was able to. Uh, I was feeling I'm doing something really useful, kind of thing, not for money or anything, but useful kind. So I realized I'll stay back, and then I am now practicing at Palakkad. Now more focused on infertility. When it comes to infertility again, people are in so much of mental trauma, and they many of them would have gone to many other fields like Ayurveda, natural medicine, homeopathy, and then they will ask, as Madam told, they will ask about Ayurveda. I used to say I'm not an expert at Ayurveda, so I can only advise in my subject, kind of thing. And a lot of so many wrong ideas are there. And then I realized maybe I should learn more about all these things, and the advice or whatever my reach to the patients would be much better. But I didn't find any course or anything. Suddenly, I came to know about this from Dr. Sri Devi from Palakkad Medical College. Then I thought I'll take 5 days off and I'll come here. So I have come here. Thank you.
Good morning. I'm Dr. Ajit Chakravarti from Trivandrum Medical College. Working for the past 25 years in the area of public health and community medicine and other branches, and currently working as a as professor in community medicine, and that is the official perspective. And unofficially, I'm practicing as a senior consultant in reproductive and sexual medicine, and it's very rare specialty. And so basically, these areas are areas we discussed. So even we are supposed to teach students regarding the sociology and this part, but my son is studying in Europe, and in his curriculum, these are all aspects which are more given importance in the even in the first year itself. But in our curriculum, these the how to handle, or rather these things are never been given importance in the curriculum. And these areas, as now, since I have been going through this own system, and these are all areas still Greek and Latin for me, and I would like to learn more about it. And regarding, as Madam said, I last 2 weeks back I went for a workshop in National Institute of Health and Family Welfare regarding basic course in infertility management, and all it is most of my co-participants were the HODs of Gynec HODs and most of the AIMS college. And so I could understand that. So majority of the those doctors are not sensitized about the sexual. So basically, as everybody is focused on the reproductive health only. So the other aspects, the emotional aspects, and that, so the pressure they will be getting through these areas are least focused, or rather just focus on the mechanical aspects of getting pregnant. So those are so those are the areas which you need to propagate. And since it's a huge area, I think, so I need to learn a lot from you people. That's why I am here. Thank you.
So myself, Manu, I am a PhD scholar under University of Calicut. So currently I pursue my research at St. Thomas College, Thrissur, and the Department of English. And my research topic is regarding cancer-based autobiographies of doctors and patients, a comparative study based on the perspective of medical humanities. And I am on my third year. So actually, how I came to this area, that lot of influences that I had ever since my school days, because you all might have heard about A.J. Cronin, the English author, who has written the famous works like Criticism of Doctors. So one of the short stories named Birth was enlisted for the CBSE syllabus where I studied. So when I went to a BA, one of my teachers told me about Unatil Kunyabdullah's work, Marunna, which is almost like a criticism of doctors similar to A.J. Cronin. So I just searched out the public library at Kollam, which is my native place. And I didn't found Marunna, but I found like an autobiographical kind of work that he written was Atmavishwasam Nalla Marunna. In translated in English, self-confidence is the best medicine, where I found a lot of interesting bits. Like what really made me interested was his description about the apparatus of the consulting room that a doctor should possess, like properly ventilated rooms. It should have a flower pot, have well watered, a freshly dressed doctor, such kind of apparatus that every doctor should set up in their consulting rooms. And that literally may invested a lot of interest in me. But during my post graduation, I didn't come to this area, and I went to for MPhil at Sri Shankaracharya University of Sanskrit, Kaladi, where during my discussions with my fellow scholars, we landed onto this topic, and there I did a comparative study again with the autobiography of Dr. Paul Kalanadi. He has an autobiography, When Breath Becomes Air, in comparison to Innocent's autobiography, its translated work, Laughing Cancer Away. cancer ward literally is translated to English as laughing cancer away. So I was comparing these two works on a psychological perspective, and the perspective I took was Dabrowskian psychology. Simeon Dabrowski, he was a Polish scientist and a psychologist. So his theory of positive disintegration, he says that any kind of nasty episodes in life eventually become a positive influence in a person. That disintegration eventually becomes positive. That was his perspective. Based on that perspective that I have approached these works and I have submitted my dissertation. So within a span of 1 year, by 2020, I have applied for Calicut University, where I have expanded this very same topic, taking almost 5 autobiographies, both doctors and patients, including doctors and patients, because we are people from literature, we have to do some kind of touch on these literary aspects, or else we won't be approached. That's a limitation that we have in literary research here, especially. So I take 5 autobiographies, 3 of them by oncologists, them by patients, and 2 of them by oncologists. So I had a lot of confusions with how to take these texts, the section writing, a lot of things. So during this time that Mr. sir has invited me to all this workshop, we had a lot of interactions before. In 2022 July, we have attended a seminar at Kodungalur KKTN College, from where all these contacts have started. So whenever there's a workshop or any kind of activity going on, he immediately inform me. What interested me to come here was I found that many doctors are taking part here, and we have one session with patient interaction too, right? So the coming days. So whenever I discuss my topic with my fellow scholars at other departments, especially science departments, what they all ask me is like they all approach research in a quantitative manner. Obviously, that's how scientific research are done. But for people from humanities like us, most researchers are qualitative in tone. So they all have this doubt. Without directly interacting with the patient, how could you pursue a research in cancer narratives, especially in this medical perspective? That was the doubt that they all have asked. And I expect this very same question during my defense as well. So I thought like, okay, without direct interaction, I could not move with, okay, at least I should have a minimum experience with direct interaction with patients and doctors in person rather than just analyzing few books at an autobiographical, because autobiographies can at times be fictional as well. You cannot analyze completely how much fiction is added by these people, not to for the rating value or the commercial value of these books. So I thought that this workshop would really be helpful for me on this regard. Thank you.
So my name is Wafa, and I'm doing my PhD in sociology at JNU, the Center for the Study of Social Systems. So I came to know about this program quite late. I think 2 days back, I found that one slot is available. Such a message was shared in the MFC group in the Medico Friend Circle. So I panicked and I texted suddenly, and I was like, "Is the slot still available?" So it's like apparently it was. So I'm here. And basically, my PhD is on medical knowledge and medical epistemology. So, what I am doing is I am observing doctors and medical students in their environment, which is I'm doing an ethnography of the Calicut Medical College, Government Medical College, and I observe what basically these people do, which because I believe that a lot of studies in the sociology and anthropology of medicine have unfairly focused on patient narratives, doctor patient interactions, while the other side of the whatever the spectrum, or like the actual power holders or the actual stakeholders of the entire system, we have left them entirely to their own. We have not looked into what are these people doing, because they're the ones who is deciding how medical knowledge should be reached out to people, how it should be executed, what should be considered as medical knowledge, what is science, what is medicine, and all of that. So basically, what I'm doing is I attend classes, MBBS classes. I look at how they teach medicine, how they learn medicine. I also attend labor rooms, operation theaters, then ward discussions, case discussions, and try to observe as much. And I'm just right back. I've just finished my field work,
and I'm happy to be here. My name is Ashita. I'm a research scholar at the Department of Philosophy, University of Hyderabad. I'm working in philosophy of psychiatry, and especially on the problem of reduction in psychiatry, which tries to characterize mental disorders as disorders of the brain diseases, and also on the ontological status of mental disorders. Um, yeah, so I can already see that there are people interested in that area. I'm happy to know that and happy to have a conversation with all of you. Okay, it is about what kind of reality do mental disorders have. There is a debate going on in philosophy of psychiatry whether there is actually mental disorders that exist just like cancer or any other physical illness is existing, or are they merely social constructs that we create to label certain conditions that we condemn, like socially not acceptable, so we give it a name and treat. So there is a debate going on there. So I focus on that debate as well, and anti-psychiatry movement comes as a part of it. There were people who actually claimed that mental disorders are myth. Okay, there is nothing like that. It's not medical categories. So that is where my research is focused on, and I always find like such groups where people from multiple disciplines are part of very interesting. One, because we get different perspectives. So me as a person who working in philosophy of psychiatry often gets this comment that, okay, we doctors are not concerned about all these issues you philosophers are talking about. And I find that very like, it's a sad thing for me to know that. And when it comes to groups like this, we have doctors, and I have actually given a talk before. Brahmaputran sir gave me a opportunity to give a talk as part of Keralium. Yeah. So there as well, I could talk to some doctors as well. And when I come to know that, okay, some doctors are concerned about this, I get actually a relief. Okay, there is a quote by like a comment by Feynman, a philosopher, that philosophy of science is as useful to scientists as ornithology is to birds. Okay, this comment is often used to say that, okay, you're using like doing a useless job talking about science. Philosophers are doing that. So actually, I get a relief that, okay, some people are concerned about such questions as well. So I'm so happy to be here.
Philosophy from Calicut University, and my research area is medical phenomenology. And I came here the same reason, that is, even I started developing a critical approach towards my own research area, medical phenomenology, about its relevance, what distinct contribution that medical phenomenology have in clinical practice. And I hope this workshop will give you a clarity of thought. Thank you.
I'm Annie. I'm a first year PhD scholar from MIT Trichy. So I am here basically as a blank slate. I want to imbibe as much as I can. I want to soak in as much as I can. And I'm really glad that it is a confluence of different disciplines, be it medicine or philosophy or history, science. So I'm looking forward to this. So my current area, so why I got interested in this particular discipline was that as a part of my master's, I did a course called Epidemic Narratives as part of my cultural studies course in IFLU, Hyderabad. So yeah, currently I am leaning towards rumors and anxiety and epidemics. So how do rumors become a narrative? So that's my current area of interest, and I hope that this particular gathering can inform my research in the future as well. Thank you.
So I'm Rahima Tasneem. I'm a research scholar at NIT Trichy, and I'm from the literature background. So I read autopathographies, especially cancer narratives, and I focus on phenomenology of illness. So I'm so glad to see people from different backgrounds, and I'm here to know more about different perspectives on illness, health, like especially from philosophical background, sociological background, clinical background. Yeah. And I would like to look beyond the clinical understanding of healing. And I'm quite excited. Thank you so much.